All right, skincare. Um, who doesn't love talking about skincare?
Mm.
It seems like, everyone's got their routine and the products they swear by. But honestly, it can get kind of overwhelming, right? Like, where do we even start?
Right. There's so much information and so many products out there.
Exactly. So for this deep dive, we're going back to basics, focusing on what really matters for healthy skin. We've got excerpts from two amazing skincare pros, Caroline Hirons' book Skincare and Anjali Mato's The Skincare Bible.
Yeah, these are both like really respected voices in the skincare world.
For sure, and they come from different backgrounds too, which I think is so interesting.
Yeah. We've got Caroline, who's got like years of hands-on experience as an esthetician.
Right, like from the trenches.
Exactly. And then Anjali, who's a consultant dermatologist. So she's coming at it from like a medical perspective.
So we're getting that like 360-degree view, which I love. We'll be covering like everything from building a solid routine to busting some myths.
Oh, there are so many myths.
I know, right? Like that thing about ingredients penetrating deep into your skin. Well, have you heard of the 500 Dalton rule?
Oh, yeah, the 500 Dalton rule. It's a game changer.
It explains why some of those, those claims are just scientifically impossible.
Like, it can save you a lot of money, on products that aren't going to do what they promise.
Right. No more falling for the hype. But before we jump into all that, let's start with the basics. How does our skin actually work?
Yeah, both books emphasize this. Like, understanding the structure of your skin is foundational.
Okay, break it down for us.
So think of your skin as a layer cake. The top layer, the icing, that's the epidermis. It's what you see and touch.
Okay, got it. The epidermis.
Right. And that's what most like over-the-counter skincare products are actually targeting. Anything that's going deeper, like Caroline says, needs a prescription or, a needle.
So those DIY skincare hacks claiming to, reach deep wrinkles, probably not happen.
Probably not. Then under the epidermis, you have the dermis. That's the filling of our cake.
Okay, so epidermis on top, dermis underneath.
Exactly. And the dermis, it's thicker, full of blood vessels, nerves, and it has these connective tissues like collagen and elastin.
And collagen and elastin, those are the proteins we lose as we age, right?
Exactly. That's why we get, less bouncy skin. And hyaluronic acid, it's like bathing these proteins. It's a natural moisture magnet.
Okay, I'm loving this cake analogy. It's making it so much clearer.
Good. And then the base of our cake, that's the subcutaneous tissue. It's mostly fat and connective tissue, which, supports the skin. And this also diminishes as we age.
So understanding these layers is like, I don't know, having a cheat sheet for skincare.
Right. You can actually understand what those products are claiming to do and if it's even possible.
Okay, foundation check. Now let's talk routine.
Yes. A good skincare routine, and both authors agree it doesn't have to be super complicated.
I like hearing that. I know Caroline is a big fan of what she calls the bookends of skincare, cleansing and moisturizing.
Yeah, she sees those as the non-negotiables. And I completely agree.
They're the foundation.
Absolutely. And speaking of cleansing, Caroline actually has this really interesting tip.
Okay, lay it on us. I'm intrigued.
Ditch the makeup wipes.
Really? Like, completely?
She's not a fan. She says they just smear stuff around. She recommends using a soft flannel instead. Much more thorough.
Interesting. Okay, noted. Now, I think we can all agree, the holy grail of any skincare routine.
SPF.
SPF for sure. And both books are adamant about this, right?
Absolutely. Every skin type, every day. Anjali stresses that it's like the single most effective way to prevent premature aging.
And of course, it helps protect against skin cancer.
Definitely. And, it's surprising, but Caroline cites some pretty alarming statistics in her book.
Oh.
Melanoma rates have been rising even though sunscreen is so widely available.
Wow, that's a wake-up call for sure.
It is. So it's not just about applying SPF once in the morning. We need to reapply, especially after sweating or swimming. And, don't forget those easy-to-miss spots like your ears, the back of your neck.
Got it. Reapply and cover all those spots. Okay, so we've got cleansing, moisturizing, and SPF down. But what about, like, all those other products?
All those serums and acids and mists.
Yeah, it's a lot to navigate.
It can be, but think of serums as your, targeted treatments.
Targeted treatments. Okay, so they're, like, delivering those potent ingredients deeper into the skin.
Exactly. And acids.
Acids. Everyone's talking about acids.
I know, right?
Yeah.
They're like chemical exfoliants.
What do they actually do?
So they help to, shed those dead skin cells.
Okay.
They reveal brighter, smoother skin, minimize pores, fade dark spots, even reduce the appearance of fine lines.
So they're like the multitaskers of the skincare world.
Pretty much. Caroline actually has some specific product recommendations in her book, for different concerns.
Oh, like what?
Like for dry skin, she loves Weleda Skin Food. It's like a cult classic.
Oh, yeah, I've heard of that one.
And for acne, she recommends the Sunday Riley Ceramic Slip Cleanser.
Okay, so those are some good starting points. But before we go full-on product crazy, we've got to talk about the myths.
Oh, yes. So many myths out there.
And they can lead us down the wrong path.
Totally. Have you ever heard of skin purging?
I think I've seen that term on social media, but to be honest, I'm not really sure what it means.
Well, both authors actually debunk this whole idea that over-the-counter products can cause a skin purge.
So, like, if your skin breaks out after trying a new product, it's not purging, it's reacting.
Exactly. It's a sign that that product might not be right for you.
And you should probably stop using it.
Yeah, best to discontinue use. And another myth, cellulite creams.
Do they really work?
I wish. Unfortunately, no cream can just erase cellulite. Anjali explains that it's caused by fat cells pushing through like weakened connective tissue.
So it's more about hormones, genetics, lifestyle, not something a cream can fix.
Right. Now, speaking of buzzwords, we have to talk about the clean beauty movement.
It's everywhere these days.
I know, right? And both books offer some really interesting perspectives on this.
Yeah, like Caroline is pretty skeptical about how the term clean is used.
Yeah, because it's unregulated.
Exactly. Like there's no clear definition.
And it's often used like as a marketing tactic.
And Anjali, does she have any thoughts on clean beauty?
Well, she cautions against assuming natural is always better. Even natural ingredients can be irritating for some people.
It's about being informed, not just blindly following trends.
Right. Sometimes those natural alternatives aren't as effective as their synthetic counterparts.
It's all about finding that balance, right?
Exactly. And finding what works best for your individual skin. Now, skincare isn't just about what we put on our skin. Both books talk about how lifestyle factors play a huge role.
Totally. It's like that saying, beauty comes from within.
Right. Things like sleep, stress, diet, they can all have a big impact on your skin.
So we need to take that holistic approach.
Absolutely. Anjali actually goes into detail about the skin's circadian rhythm.
Circadian rhythm. Okay, tell me more. I know it has something to do with sleep, right?
Yeah, so just like our bodies have those natural sleep-wake cycles, our skin follows a similar rhythm.
So our skin functions differently at night than during the day.
Exactly. Skin cell division and repair peak at night. Oil production is higher during the day.
So it's like we're working with our skin's natural processes.
Exactly. Now, what about hormones? Hormones can really throw things off, right?
Oh yeah, puberty, pregnancy, menopause. Hormones can definitely wreak havoc on our skin.
For sure. And both books explore how these changes can lead to, acne, dryness, pigmentation.
It's like our skin's on its own hormonal roller coaster.
Hmm.
But understanding these changes can help us, adjust our routines.
Right. We can support our skin through those different stages of life. It can feel like that sometimes. But hey, if we understand those changes, we can adjust our routines, right?
Right. So it's not like a
No.
one-size-fits-all approach. It changes as we do.
Yeah.
So let's break it down. What about those in their 20s and 30s? What are the key things to focus on?
Well, those are like the foundation years, right? Consistent cleansing, moisturizing, and can't emphasize this enough, daily SPF.
The Holy Trinity.
Exactly. Caroline's a big advocate for adding acid toners in there, too, during those years.
Acid toners, those are the ones with the AHAs and BHAs, right? What's the benefit?
Yep, exactly. She suggests, even just twice a week, using a glycolic acid toner can make a big difference.
So it's like exfoliating.
Yeah. Gentle exfoliation helps boost cell turnover, kind of like a mini workout for your skin.
I like that, a workout for the skin. So we're setting ourselves up for success later on. Okay, so then we hit our 40s and beyond. What shifts should we be aware of?
Well, collagen production naturally starts to decline around then, so you might start to see, those fine lines and wrinkles becoming more prominent. Both authors recommend incorporating retinoids into your routine at that point.
Retinoids. Those are the gold standard for anti-aging, right?
Yeah.
But I've heard they can be a bit irritating.
Yeah, they can be. Caroline actually talks about the retinoid uglies in her book.
The retinoid uglies. Okay, I gotta know, what are the retinoid uglies?
Basically, it's like the potential side effects you might get when you first start using retinoids. Dryness, redness, flaking, that kind of thing.
Ah, so it's like your skin freaking out a bit.
Kind of, yeah. It's a normal adjustment period, and it doesn't happen to everyone. But it usually subsides as your skin gets used to it.
So start slow, Be patient.
Exactly. And definitely wear SPF during the day, especially when using retinoids, because they can make your skin more sensitive to the sun.
Got it. SPF, always. Now let's talk about another big shift, menopause. It can really impact our skin, right?
It really can. Because of those hormonal fluctuations, especially the decline in estrogen, both books, they acknowledge all the changes our skin goes through, thinning, dryness, even a higher risk of pigmentation.
So what's the best way to, support our skin through that?
Well, Caroline stresses adapting your routine. Focus on hydration, gentle exfoliation, and maybe incorporating products that support collagen production.
What kind of products?
Things like peptides, ceramides, things that help strengthen the skin's barrier. And Anjali actually brings up a really important point in her book. She talks about, the psychological impact of these changes.
Yeah.
It's okay to seek professional help if you're feeling overwhelmed or self-conscious about how your skin is changing. It's all connected, Our mental health, our skin health.
Yeah, taking that holistic approach. Okay, so we've talked about the big picture, but what about those everyday skin issues, the blemishes that never seem to go away?
Oh, those unwanted guests. Both books offer some practical advice there. Caroline, she suggests actually moisturizing the area around a blemish.
Really, I usually try to dry them out as much as possible.
Well, she says that moisturizing can actually help soften the skin and encourage the blemish to, either retreat or come to her head quicker.
Okay, that's an interesting approach. What about toothpaste? Does that work?
Oh, no. Big no-no. According to both authors, toothpaste is for teeth, not your face.
Makes sense. So moisturize around it, no toothpaste. What else?
She recommends using an acid toner on the blemish itself. Helps to kill bacteria, but doesn't overly dry out the surrounding skin.
Targeted treatment. Now, what about those tiny white bumps? Milia.
Oh, those can be stubborn. She suggests gentle exfoliation, using an acid toner, and regular play masks that can help to soften them.
So it's all about knowing what approach to take for each specific concern. Sometimes, though, those at-home remedies aren't enough, and we need to call in the professionals. Both books talk about navigating that world of skincare treatments.
Yeah, which can be overwhelming. There are so many options out there.
So many. Facials, lasers, injectables. Where do you even start?
Well, Caroline breaks down different facial types in her book. She actually suggests starting facials for acne earlier, maybe even in your teens. But for aging concerns, it's better to wait until, your mid-30s or 40s.
So it depends on what you're trying to address. And of course, finding a qualified practitioner is key.
Oh, absolutely, someone you trust. Anjali also goes into the world of injectables like Botox and fillers. She explains how they work, the benefits, the risks, and really emphasizes informed consent before doing anything.
It's so important to do your research. But as both authors say, even with the most advanced treatments, skincare is still crucial.
Absolutely. It's about maintaining that healthy foundation. Skincare is a journey, not a quick fix. And speaking of, you mentioned the 500 Dalton rule earlier. Can you remind me what that's all about?
Oh, yeah. Remind me.
It's basically a scientific principle that explains why some ingredients can't penetrate the skin's barrier, especially, larger molecules. Caroline uses this to debunk a lot of the marketing hype out there.
So those claims that a product can, deliver collagen deep into the skin, that's bogus.
Pretty much. Collagen molecules are way too large to pass through. And she also talks about this practice called angel dusting.
Angel dusting. Okay, that sounds intriguing. What is that?
It's when brands add tiny amounts of trendy ingredients just for marketing purposes. So they might sound impressive on the label, but they're not actually doing anything for your skin.
It's all smoke and mirrors.
Sometimes, yeah. It's important to, read those ingredient lists carefully.
Be an informed consumer. I love that Caroline dedicates a whole section in her book to debunking skincare myths. It's like such a breath of fresh air.
It is. And one myth she tackles is the idea that professional strength products are always better.
Oh yeah, I've totally fallen for that one, thinking I needed something super strong to get results. What's the truth there?
She argues that professional strength is often just a marketing tactic and that you can get great results with well-formulated over-the-counter products.
So it's not about the price tag. It's about finding the right products for your skin.
Exactly. And both authors emphasize the importance of, seeking professional guidance when needed. Whether it's an esthetician or a dermatologist, there are experts out there who can really help you.
Sometimes it's good to have that extra support. Okay, wow, we've covered a lot of ground. Structure, routine, products, treatments. It's been a real deep dive.
It has. And I think the takeaway is that, healthy skin, It's about overall well-being.
It's inside and out.
Exactly. It's about those conscious choices about the products, the treatments, the brands you support, and realizing that, there's no one-size-fits-all approach.
It's a personal journey.
It is. It's about finding what works for you and feeling confident in your own skin.
Feeling good.
Yeah.
And it's a journey, right? It's constantly evolving.
Exactly.
So now that we've, gone through all this, what's one thing you're going to change about your skincare routine? Are you going to swap out those makeup wipes for a flannel? Commit to daily SPF. Do some research into the brands you're using.
We've given you the tools and the knowledge. Now it's up to you to create that routine that, works for you, reflects your values, and makes you feel your best.
Well said. And on that note, I think it's time to wrap up part 2 of our deep dive into skincare. We'll be back with part 3 to discuss a really important aspect that both authors touch on the ethical side of skincare. Okay, we're back for the final part of our skincare deep dive. So we've talked about the science, the products, the treatments, but there's another layer to all this, right?
Yeah, the ethical side of things.
Exactly. It's easy to get caught up in the quest for, perfect skin.
Totally. But we should also be thinking about the impact of our choices on the environment, animal welfare. It's this whole idea of conscious beauty.
And Carolyn, she really gets into this in her book, especially the whole clean beauty movement. She has some pretty strong opinions about how that term gets used, right?
Oh, yeah. She's super vocal about the lack of regulation around clean beauty.
Because it's such a buzzword. But what does it even mean?
Right. There are no real standards or definitions.
It's just marketing.
A lot of times, yeah. And she calls out those brands that use scare tactics, like demonizing certain ingredients without any real evidence.
Fear-mongering.
Totally.
Right.
Making people afraid of things without any proof that they're actually harmful. She also talks about greenwashing.
Greenwashing? What's that?
It's when brands, kind of exaggerate their environmental or ethical practices just to appeal to those, conscious consumers.
So it's all about, being a savvy consumer.
Right. Do your research. Support brands that are actually aligned with your values.
So how do we actually do that? What should we be looking for when we're trying to figure out if a brand is ethical?
Well, Caroline actually gives a great checklist in her book. She says, ask yourself, do they test on animals?
Oh, so yeah, that's a big one.
Right. Are they transparent about their sourcing and manufacturing processes? Do they support fair labor practices? Are they taking steps to minimize their environmental impact?
It's about looking beyond the product itself.
Exactly. It's about the bigger picture.
Both authors also talk about animal testing in the beauty industry.
Yeah.
Which is such a complicated issue.
It is. Carolyn points out that even though animal testing is banned in the EU, some brands might still sell their products in countries where it's required.
Oh, wow. So even if a brand claims to be cruelty-free, it might not be the whole story.
Right. It's worth looking into their global practices.
So it's awareness is key.
Definitely. And as consumers, we have power. We can demand more transparency from the beauty industry.
We can vote with our wallets.
Exactly.
It's about recognizing that our choices, they have a ripple effect.
They really do.
It's not just about what works for our skin. It's about making choices that, are good for the planet and for other people.
Thinking about the bigger picture.
Yes. Okay, wow, we've really gone deep on this. From skin structure to routines to products to treatments to ethical considerations, what do you think are the biggest takeaways for our listeners?
I think the key takeaway is that healthy skin is a reflection of our overall well-being.
It's an inside job.
Exactly. And it's about making conscious choices about, everything, the products, the treatments, the brands. And there's no right answer for everyone.
It's personal.
It is. It's about finding what works for you.
And feeling good in your own skin.
Exactly. It's a journey. It's about learning and adapting as you go.
So well said. We've given you the knowledge. Now it's about taking action. So for everyone listening, how are you going to change your approach to skincare?
Right. What are you going to do differently? Will you ditch those makeup wipes? Finally commit to daily SPF, research the brands you're using.
It's about taking that next step, creating a routine that truly works for you. And that wraps up our deep dive into the world of skincare. We hope you feel empowered to take charge of your skin's health and make choices that reflect your values. Until next time,